Hello, my name is Gabriela Monge. I will be the speaker today. The title of my presentation is Effects of Cannabis Amongst Adolescents. This is for Professor Craig Winkelman's class, and the course is for Health 336 class, which is named Health Aspects of Drug Use. And I will begin. So the overview of cannabis. So marijuana or cannabis, they're both interchangeable. So marijuana is a dried up leaves from the flower Cannabis sativa or Cannabis indica. So marijuana is made up of many chemicals, and one of the main chemicals is delta 9 tetrahydrocannabinol, which is also known as THC. So this actually provides a the psychoactive, since this provides a psychoactive sensation. So the potency has increased since 1990s. And in some of the statistics regarding high school students would be 37% of the US high school students have reported lifetime use, and 22 had reported marijuana use in the past 30 days. So this is a public health concern because due to the accessibility amongst adults over 21, and this can increase to, since our brains do not finish developing up until the year 25 years of age, teen use of marijuana can lead to difficult thinking, problem solving, reduced coordination, and the inability to concentrate. Also can bring issues to school and social life, according to the CDC. So, like I mentioned, this is a public health concern due to the accessibility of cannabis amongst adults. Marijuana has both short and long-term effects. So concerns about risks of adolescent cannabis use, such as heavy use, specifically on development, educational outcome, and cognitive impairments. So being in California, Proposition 64 has permitted adults 21 years of age to grow and possess marijuana for recreational and medicinal use. So this is all facts from the DEA. So some of the severity of teen cannabis use. So according to the WHO, 147 million people, or 2.5 of the world's population, has consumed cannabis. And according to the WHO, cannabis is closely related to youth culture. So marijuana is the most commonly used federally illegal drug, and about 48.2 million people, or 18% of Americans, have used it once in 2019. In the past year, about 1 in 8 adolescents from 12 to 17, which is 13%, have used marijuana in the past year, which is about 3.3 million teens. And past year vaping of marijuana has also remained steady in 2020, but it increased in 2018 and 2019, according to the CDC. So these are some of the epidemiology trends and population who are at higher risk. So from 2014 to 2019, there was amongst college students, there was a 9% 5-year increase. So they are at a historic high for both college students, which are young adults, and non-college students at 43, both at 43% in 2019. And daily use of cannabis use was 3 times as high amongst young adults not attending college compared to their peers in college. So according to this statistic or trends, individuals who are not in college are at higher risk of consuming cannabis daily use, according to the NIHA. Preventing marijuana use amongst youth. So this is statistics from the DEA. On a community level, we could join local schools or communities anti-drug coalition, or start one if one is not recognized, to bring awareness and help individuals, families, and communities bring awareness to drug use and how it impacts from an individual to a community level. Organizing a prevention information fair to raise awareness regarding the impact of drugs. So these are both a community level. So there are programs such as the Red Ribbon Week, which is an opportunity for children, adolescents, and adults to show that they are committed to staying drug-free, which occurs in of October 23rd to the 31st. A National Prevention Week is held in May. So this is a nationwide recognized event to stress the importance of substance prevention and misuse. There are treatments such as cognitive behavior therapy, contingency management, and motivational enhancement therapy, which are provided by the government website. And this could help individuals stop using cannabis. And since there are withdrawals of cannabis, people would use drugs like Ambien, bus buspirone, and gabapentin. I can't really pronounce these, but these are some drugs that will be prescribed if an individual is struggling with cannabis use. And lastly, these are some of the policies. So cannabis use first became medicinal in 1996. And since California does require all marijuana products to have warning labels, which include this product can expose you to marijuana smoke, which is known to the state of California to cause cancer, birth defects, and other reproductive harm. And in January 1st, 2021, 14 states and the District of Columbia have legalized the recreational use of cannabis, yet federally, cannabis is still illegal. And these are my resources, and this concludes my presentation. Thank you so much for listening.